Hi, my name is Erica and I'm one of the faculty here at Blessing Freeman College of Nursing and Health Sciences. Today I'm going to show you how to perform tracheostomy care. We're going to start by gathering our supplies. So I have some sterile saline, hydrogen peroxide if our agency allows it, a tracheostomy care kit, and I like to always have an extra pair of sterile gloves just in case I need them. It's important when you're grabbing your supplies to know what's in your trach care kit, to know the kit your agency uses, to know if you need any additional supplies. If your patient has a lot of secretions around their tracheostomy, you may need some extra cotton-tipped applicators to be able to clean, or maybe even some extra gauze, what have you. So make sure you know what's in the kit and how many secretions, etc., that your patient's trach have. See if you need to gather any additional supplies at that time. After you've gathered your supplies, you're going to go to your patient's room, do your AIDIT, verify your patient's identity. So now you're ready to open your kit. We're going to go ahead, I'm going to start with kind of moving this stuff off to the side, my peroxide and my saline, because I want to make sure that I have room to open my sterile field up right here. I also want to make sure I've got some room to open up my sterile gloves. I'm going to, since I'm not sure if I'm going to need these extra set of sterile gloves for now, I'm just going to set them to the side on another table. Then I'm going to go ahead and open my kit. I'm going to make sure that I don't touch anything inside the kit as I'm taking the lid off. You can just rip that lid completely off when you're doing this in the real world. However, in the lab, we tend to just tuck it underneath. And then I can see my sterile gloves are right on top, so I can go ahead and I can grab those out. I just need to make sure that I don't touch anything underneath. If you're able to go ahead and get that sterile drape out without contaminating anything underneath, you could go ahead and take that out. However, I'm not certain that I can get to it, so I'm going to go ahead and put my sterile gloves on first. But before I do that, I'm going to open my saline and open my peroxide bottles, so that way I don't have to open them with sterile gloves on, because it's much more difficult to do. So I'm going to go ahead and take those lids off, and when I set them on the table, remember that I need to invert them or flip them over to make sure they don't get contaminated. I'm going to go ahead and put my sterile gloves on the end of the table, so that way you're able to see that a little more clearly. To apply my sterile gloves, I'm going to open the package. I'm going to make sure when I'm opening the package that I'm only grabbing these flaps here. I'm not reaching in because I don't want to contaminate the package, contaminate the gloves, excuse me. So I'm going to open that. If this package wants to close, you can kind of just bend it, make a little tent, and it should stay open for you. It doesn't matter which glove you put on first, it's a matter of preference. I'm going to put my left one on first this time because my right one doesn't have quite as good of a cuff in it. So, excuse me. To do that, remember I'm going to pinch up on the first glove, so I'm only touching the part of the cuff that's going to touch my skin. Get my fingers in that and pull it on. Then with this one, I'm going to come underneath of the cuff, so my fingers are only touching what will be the outside of the glove. My fingers in that and pull that on. If you needed to adjust your gloves at this point, if one of your fingers didn't get in the right hole, you could do that now that you have both the gloves on, because you can touch these because you're sterile. Just make sure that as you pull them on, you kind of just pull them from up here. Don't grab down here by the cuff around your wrist, because then you are going to contaminate yourself by touching your wrist. Okay, so now I'm going to go ahead and finish setting up my sterile field. So now that I have my sterile gloves on, I am able to reach in here and grab this drape, and I don't have to be worried about only touching the corners of it when I open it. So I'm going to open this up. I want to make sure that the shiny side goes down. And remember, you're going to take the end furthest away from you and bring it down. Then I'm going to take the rest of the supplies in my kit and just organize them however I like, or however you like. You'll have a trach dressing to put underneath the trach when you're done. You'll have some gauze that you can use to clean to dry. You'll have a scrub brush to clean the inner cannula. You will have a suction catheter in case you need to suction. You will have trach ties, and some sterile content applicators. Again, you may very well need some more of these. And if you did, you could have somebody drop those on the field for you. This would be where it would come in handy if you had an extra pair of sterile gloves, because you could drop the extra supplies on your field and then you could change your gloves into a fresh pair. Okay, so now I have my field set up how I want it. I need to go ahead and pour my fluids into my container. Blessing does allow the use of peroxide when doing trach care. You can use it not only to clean your inner cannula with, but they actually also allow you to use it on the trach care site if you need to. However, just remember that hydrogen peroxide can be very irritating to the skin if it stays on there. So if you do use peroxide around, like on the flange, on the actual trach itself or anything, you need to make sure that you rinse it really well. We're just going to clean the site today with normal saline, but we will clean the inner cannula with hydrogen peroxide. So what we'll do is, at this point, I want to think about which hand I want to remain sterile and which hand I want to contaminate to become dirty. So I'm right-handed, so I'm going to keep my right hand sterile, and I'm going to use my left hand, and I'm going to come over here. Again, make sure you're not reaching over your sterile field. I'm going to come over here, get my saline. There's 3 containers in this kit. It makes no difference which one you use for what. I am going to put saline in this big one, and also in the medium-sized one. Actually, no, that's not what I wanted to do. So I'm going to do saline in the big one and the small one. Again, it makes no difference. It's your preference. But I'm going to do the saline in the big one and the small one. And then I'm going to take the peroxide. Remember, when you're pouring liquids, to put the label to your palm. And then I'm going to put the peroxide in the middle one. Again, it's your preference. Whatever works best for you. So now that I have that, I'm going to take this inner cannula out. If this was a disposable cannula, I would simply throw this away, and I would have had a new sterile one package open ready, so I could throw this one away, I could pick up the sterile one and insert it. But for our purposes today, we're going to clean this. So I'm going to put this into the peroxide, let that sit there, and I'm going to go ahead and take the dressing out as well, and I'm going to throw that in the trash that I have here by my feet. So now that I have the inner cannula out, I can decide if I want to go ahead and clean the inner cannula and put that right back in, or if I want to clean around my patient's trach care site first. Each patient's going to be a little bit different. Some patients, you may want to go ahead and get that inner cannula right back in for them. In that case, you would go ahead and clean the inner cannula and replace it, and then do the site care. Or maybe if that trach has a little more secretions on it that it needs to soak a little bit longer, you can go ahead and do your site care first. I'm going to go ahead and clean my inner cannula first and then replace it, and then I'll do the site care. As with any sterile procedure, you want to make sure you remember which hand is sterile and which hand is dirty. My left hand is dirty, so I'm going to use that hand to pick up my inner cannula, holding it just on the end right here. That is the part that's outside of the patient, because that end is not going to be sterile anyway. Then I'm going to pick up my scrub brush, can dip it in the peroxide, and then insert it into the cannula, clean it. Try not to go up all the way through, because you don't want to take stuff that's out here on the outside of this and pull it through the sterile end of the catheter of the cannula. So I'm going to scrub this. If I need to, I can dip it back in there and scrub it. Now you'll notice I'm kind of over here. I'm not right over my sterile field, because I don't want to drip anything from here. I mean, if I'm over my peroxide, I guess that's okay because we've been in there, but you don't want to be over your sterile field or anything. So just be mindful of what you're over when you're cleaning the inner cannula. I'm kind of do it here so you can see that. So I'm going to make sure that I'm brushing it, getting it all the way clean. When I'm done with this brush, make sure it goes to the trash. You can either have a trash by your feet. You can also go to the sterile glove package over here. Remember to drop it so you don't contaminate this hand. And then I'm going to rinse this in the sterile saline to make sure I'm getting all that peroxide off. And then I'm just going to tap it dry to make sure I'm getting all of the water, or as much as I can of the water, off of the cannula, of the saline. A little moisture on the outside does help with lubrication. As long as you don't have big drops on the inside, you'll be okay. So I'm going to go ahead and put this back in. Make sure you hear it snap into place. So now I'm ready to go ahead and do the site care. So I'm going to use this cotton tipped applicators, and this is where you definitely could use some extras of these. Excuse me. So I'm going to dip this in the other saline so that way I'm not using the one I rinsed with. Now some kits you don't really have a choice because you only have 2 containers, but this one's nice, I have 3. So I'm going to use saline, and I can kind of move that a little bit, get up underneath of here to clean. I would get rid of that one, go more on the underside here if I needed to, but I'm going to come up here around the top. And that, make sure you don't touch your hand to the patient. I think my finger just did, in which case I would need to get a new pair of gloves. So I'm going to get rid of that one. Continue to grab more sterile cotton tipped applicators as you need to. So with my other sterile cotton tipped applicators, I want to make sure to clean the flange as well, which is the part here where the trach is secured. And then I'm going to use the gauze, can pat the flange dry, again making sure I don't touch things, getting here, getting the other one, getting underneath. And at that point now I'm going to go ahead and replace the trach dressing. This, once it touches the patient, it's not sterile, so you can certainly use both hands. I just always say try not to take your dirty hand and put it right on the slit itself. So now that you have that done, you could replace the ties if you need to. There are some things to consider when changing trach ties. The first is that if this is a new trach, the trach ties typically stay on for 48 hours to allow healing of that trach before you change the ties. And then often the ties are replaced with a Velcro strap instead of the actual cloth ties. And I'll show you that here in just a minute. But if you were gonna change the cloth ties, you would take your twill trach ties, you would take it around the back of your patient's neck, and basically you're going to tie the one side on and then tie the other side on. You're going to want to make sure that it's snug, but you're going to want to be able to get, a couple fingers in there so it's not too tight for your patient. And then you would want to cut the old ones off. That helps the trach remain secure while you're changing the ties, and you don't have to worry about it coming out. Now if you do have the Velcro ones, and they make several different kinds of these, so they may look a little bit different, but it's the same basic concept, is that you would take this around here, and this little part would go underneath of the flange and then come back and Velcro on itself. If you have trach ties that don't have quite as thin of a part to connect, it may be necessary to take the old ties off first before you put the new ones on. But please hear me with this. If you have to take those old ones off first, you have to have somebody help you. Because what you will need to do is you will have your second person hold this trach in place while you take those old ties off and put the new ones on. Because you cannot take those old ones off and then just leave that loose. If your patient coughs really hard, that trach could come out. So you want to make sure that somebody is there. So Definitely if you were by yourself, but when all possible, leave the old trach ties on, put the new ones on, and then remove the old ones. But if you absolutely have to remove those old ones first, make sure somebody is securing that trach for you. So once trach ties are changed, your procedure is over, you're ready, you can go ahead and clean up your supplies and make sure your patient's comfortable. Thank you very much. That's how you do trach care.